So when you have an acute flare-up of back pain, it's important to make sure that you work on tightening up and engaging some of your core muscles. This can help you with managing some of the pain when you go from a sitting position to a standing position, when you're rolling in bed, things like that. So when we talk about the core, we talk about four main muscles. The first muscle we talk about is a muscle called your transversus abdominis. It's a deep muscle in your abdomen. To find it and to tighten it, what I want you to do is find your pelvic bones here, and then you're gonna put your fingertips just to the inside, and then you're gonna push down. And then what I want you to do is think about drawing your belly button down and up towards your spine and tighten up that muscle. You should be able to tighten up your transversus abdominis muscle while you continue to breathe. And then generally I'd say hold for maybe 2 or 3 breaths and then relax and then repeat. Now that's isolating just your transversus abdominis muscle. So that's step number 1. The second muscle that we talk about is a muscle, or your pelvic floor muscles. So your pelvic floor muscles are underneath the pelvis. And to tighten up those muscles, what you would do is what we call a Kegel exercise. So the best cue that I like to give is you try to stop and start the flow of urine. So tightening up those muscles. Again, hold 2 to 3 breaths. And then relax. The third muscle group are your glutes. So I often will recommend you put your hands on your butt. And what I want you to do then is just try to squeeze your cheeks together. Again, hold 2 to 3 breaths. And then relax. You should feel those muscles tightening up underneath your hands. And the last muscle group are muscles called your lumbar multifidus. And those are located directly along the spine. So you can find your spine here and then bring your fingertips out to the side just a little bit. And I usually will do it on both sides here since you have multifidus on both sides of your spine. And then the next step would be try to tighten up those muscles along your spine. Often what I recommend is try to tighten up the transversus abdominis, your pelvic floor, and your glutes, and sometimes that kicks those muscles on. And then relax. Again, hold 2 to 3 breaths. And then relax. And then to set your core, you would tighten, again, all 4 main muscle groups together. So tighten up your belly, pelvic floor, glutes, multifidus, hold 2 to 3 breaths. And relax. And you would want to consider setting your core, again, before you go to roll in bed, before you go from sitting to a standing position. That can sometimes help just to stabilize the spine a little bit and help manage some of the pain.